Hello, you're watching Health Day Now. I'm Mabel Jong. In the last decade, more than 130 rural hospitals have closed due to financial problems, forcing residents to drive even further away or not get care, period. On top of that, physician shortages have left many people desperate for care. Joining me now is Dr. Jacqueline Fincher, who is finishing up her term as president of the American College of Physicians. She's an internist in Thompson, a tiny community in Georgia. Dr. Fincher, a pleasure to speak with you.
Thanks for having me, Mabel. It's great to be with you.
Why is there a shortage of primary care physicians across the country? And is it especially hard recruiting these doctors to serve rural communities?
We have an expanding population and an aging population, and aging people need more physicians.
Mhm.
Secondly, we know that medical schools expanded significantly over the last 15 to 20 years, but residency programs were not expanded. And so we have a lot more medical students and not enough residency spots. So that's some of the big issues. But I think also with regard to getting physicians to come to rural areas, we know that 21% of our American population lives in the rural areas, but only 10% of the physicians are there. And so we need to change the way we recruit physicians into medical schools to get the types of workforce out of our physicians that our country needs.
Mhm.
And we need to work to make those medical students more exposed to rural environments and those types of areas that will make them feel much more comfortable about going to the rural areas. The other big issue here, though, Mabel, is the cost of medical school. The
Mhm.
educational debt is tremendous. And the average medical educational debt coming out of medical school for most medical students is now over
Wow.
$251,000. That's a
Right.
lot.
A lot. Yeah. Now, how has the pandemic placed a significant and unexpected financial burden on rural providers to keep their residents well?
We were able to get the number of physicians in our practice up on telehealth inside of 1 week. So
Wow.
that's great if we could be able to do it. But our patients have to be able to do it on their end, right? Because it
Hmm.
requires audio and visual on both ends.
Right.
And the technology is an issue. We know in rural America that broadband is not expanded enough, and
Sure.
that's been true in our area as well. And then our older population, especially, doesn't necessarily have a smartphone or a computer in which to do a telehealth visit.
Sure. How do you see doctors' offices changing post COVID after this crisis is over? Will they look different when we get back there, when times normalize?
Some of the changes that are going to happen is the workflow space. So as we need kind of private areas in order to do telehealth with patients, we need to be able to work with our team. So we need our team connected to us more closely. And so I do think that you're going to see a real change and transformation over the next decade in how we're working in clinical teams and how we are actually spaced out in the offices and how we are using telehealth and in what kind of room or closet if you will we
Hmm.
will be in order to conduct telehealth. The use of also self-monitoring devices is a huge impact into our ability to do this and do it well.
Absolutely. Now, how do you rate the administration's work on the healthcare front so far? And how are members of the American College of Physicians feeling about the talk of expanding Medicare eligibility to people starting at age 60?
We know that there is a significant number of patients in that 50 to age 64 that have already developed chronic problems, but may or may not have good health care coverage. We want everyone in this country to be covered by insurance so that they have access to the best health care that they and our country can afford.
At the ACP, you'll be talking about health IT in depth. What other highlighted topics will be on the agenda?
The bigger concern that right now that the ACP has about a lot of these remote monitoring devices has to do with privacy and the regulations or lack of regulations around these remote monitoring devices. And that's what our new ACP policy is all about.
Dr. Jacqueline Fincher, immediate past president of the American College of Physicians. Thank you.
Thank you.
And thank you for watching Health Day Now. I'm Mabel Jong.